Welcome to Vincent Surgical Arts. I'm Dr. Drake Vincent. I'm a board-certified cosmetic surgeon, as well as a board-certified maxillofacial surgeon. Our goal at Vincent Surgical Arts is to deliver the highest quality of care, service, and excellence, while providing the most current, cutting-edge techniques and procedures. With this, we hope to provide the confidence that patients can instill in their everyday lives and careers. The terms plastic surgery and cosmetic surgery are not interchangeable. Plastic surgery is surgery that is more reconstructive or corrective in nature, while cosmetic surgery is surgery of appearance. It is often elective and focuses on the beauty of aesthetics. Here at Vincent Surgical Arts, we only perform cosmetic surgery. I have personally performed over 5,000 cosmetic surgical procedures. Please come join me as we explore the many options available to you through our state-of-the-art cosmetic surgery facility. The first option at Vincent Surgical Arts is in that of facial cosmetic surgery. My philosophy in facial cosmetic surgery has to do with the aging process. Those processes can be defined by the 3 Ds of aging. The first D is descent of the skin and the muscles of the face. The second is deflation of the skin as well as the fat surrounding the face. And the third is deterioration of the skin, meaning wrinkles, sun damage, spots. All 3 of these Ds must be appropriately addressed to give you the very best facial cosmetic surgery outcome. Descent of the tissues is often defined as saggy eyebrows, loose eyelid skin, loose mid-face skin or cheeks, jowling, as well as loose neck skin. In this photo we can see what we call hooding of the eyebrow, dermatochalasis or loose skin of the upper eyelid, a fallen cheek or a deep nasolabial fold. You can also see a sagging jowl, as well as loss of definition of the jawline, as well as excess skin and loose muscles in the lower part of the neck. Problems can be corrected by a multitude of procedures, including brow lifts, eyelid surgery, nose surgery, as well as facelifting. I have created a short scar facelift called SwiftLift that allows for shorter recoveries, less downtime, less bruising, less swelling, and even smaller scars. In this after photo, you can see the correction of the hooded brow, the excess eyelid skin, a softening of the nasolabial fold. The tip of the nose, which looked like it was downward and pointed, has now been turned upward and rejuvenated, as well as a correction of the jowl, a tightening in the jawline, and elimination of platysmal bands. I now want to talk about deflation of the skin. Deflation of the tissue can be defined by hollowing of the eyes, sunken cheeks, hollowness around the mouth, as well as thinning of the lips. In this illustration here, you can easily see deflation of the face. You can see hollowness around the eyes, the eyebrows, especially underneath the lower lids and around the cheeks. You can also see it around the mouth in what we call the prejowl sulcus, or the nasolabial fold. These areas can easily be corrected by different techniques. The first technique that I really like is fat grafting. We do this by taking fat from one area of the body. We then treat that fat and we inject it into certain areas of the face. I've done hundreds and hundreds of fat grafting procedures, and I consider myself an artist as well as a sculptor when I'm doing this procedure. Other ways that can be used would be using implants. In this illustration here, a cheek implant can be placed to increase cheek projection as well as cheek fullness. We can also do this to the chin and increase the height or projection of the chin. This can give a much more elegant appearance to a lower face. Other more simple ways to do this is with what we call fillers. This is done with an injectable filler, sometimes thought of as collagen or what we call hyaluronic acid. These fillers are produced and manufactured and put into syringes. With these syringes, we then inject the filler into the areas of the face where we feel that we need it. The advantage to these products is that you don't require surgery. They can be done very easily and somewhat inexpensively in the office without much downtime. You may have a little bit of bruising and swelling. That may only be for about 2 or 3 days. This also is very artistic, and I personally do this myself. Some places do this with a nurse, but I find it very important to use the doctor to have this done properly. The most common non-surgical simple procedure performed at Vincent Surgical Arts is that of Botox or Dysport injections. These injections help smooth and alleviate those deep persistent lines around the face. A 5-minute treatment, a few tiny droplets of injection will help relax those muscles that cause crow's feet, glabellar furrows or the 11 lines, as well as deep forehead wrinkles and lip wrinkles around the mouth. Following treatment, most patients report a more natural, softer look. These treatments last anywhere from 3 to 4 months. At that time, they will need to be re-injected. Deterioration is the final critical component of the aging process. I find deterioration sometimes is the first thing that needs to be repaired in facial rejuvenation before any descent procedures should be completed. It takes a thorough evaluation to make sure which one of these Ds needs to be done first, or if they can all be done together. Deterioration is mainly defined by wrinkling or breakdown of the skin. It can also be defined by pigment. You can see red spots, brown spots, and even black spots in the skin. This occurs by either the environment, your hereditary descent, as well as most commonly the solar or sun damage. In this photo, you can see this particular patient has what we call severe wrinkling. You can see that the wrinkles are at rest. During animation, they get deeper. You can also see a lot of precancerous type of lesions. You can see red spots, brown spots, and even black spots within the skin. This type of skin typically requires a more aggressive approach. In this particular individual, I'd also recommend doing the deterioration or the laser type of procedures first before any type of surgery is contemplated. This will improve the surgical outcome as well as patient satisfaction. Here at Vincent Surgical Arts, we have a state-of-the-art laser center. We can do anything from mild photo damage to severe photo damage. Depending on your consultation and the type of skin that you have will depend on the type of laser that we will use. Certain lasers can only be used by an experienced surgeon or physician, and other lasers can be used and done in the medical spa by an experienced master esthetician under the supervision of a physician. It's also very important before we contemplate any type of surgical procedure that the skin is in the very best condition possible. Often, I will advise the patient to have laser surgery before we contemplate any type of surgical facelifting or brow lifting type of procedure.